Tonight, it is my distinct privilege, there we go, my distinct privilege to be able to offer a distinguished speaker as well as a distinguished moderator from the Houston Chronicle for a topic which I know will be of enormous interest to all of you in this hall and more broadly, not just to this Houston community, but to every community in the United States and around the world. We are delighted to help mark the launch of Dr. Peter Hotez's new book, The Deadly Rise of Anti-Science, A Scientist's Warning. I'd like to offer a special thanks to all of our Baker Institute Roundtable members in the audience who so generously support our work, including events like this, and champion our mission. Dr. Hotez is the Baker Institute Fellow for Disease and Poverty. He is an internationally recognized physician scientist with expertise in tropical disease and vaccine development. He has been honored by being an elected member of the National Academy of Medicine and the American Academy of Arts and Sciences, a singular recognition, and he's the author of 3, now 4, books with Johns Hopkins Press. He was an important part of our Baker Institute vaccine policy project in collaboration with Dr. Kirsten Matthews and Dr. Rekha Lakshmanan, which focused on improving vaccine education and policies in Texas. And I would note it is a happy coincidence, Peter, that your speaking with us tonight coincides with the Nobel Prize for Medicine or Physiology's award to 2 scientists whose work on messenger RNA contributed and contributes to the development of vaccines. Science is in the news today, as it really should be every day. I'd also like to introduce, before Peter takes the stage, our moderator for tonight, who will be coming up after these initial remarks. We're delighted to co-sponsor this evening's event with the Houston Chronicle, and to have with us is Lisa Gray, who is the op-ed editor and a member of the Chronicle's editorial board. And with those welcoming remarks to you and to them, Peter, it's yours.
Thank you. I get my little stand here because someone of my stature over the years I've noticed, if you otherwise try to give a talk, all you see is podium. So I thought I'm thrilled to be here. I'm thrilled to be part of the Baker Institute, which was one of the big drivers for my coming to Houston 12 years ago, to be part of this extraordinary institution. And I'm so excited now to be a colleague of the ambassadors and welcoming you as well. This is so nice. And very special tonight, my wife Ann is here, which she almost never comes to my talks. And she's way in the back there, but why don't you just stand up, Ann, and say hi. I'm married 35 years this month. Can you imagine putting up with me for 35 years? Thank you. What I want to do is not give a long talk, just kind of give you just to bring everybody kind of at the same level, the same speed in terms of background, to make our conversation with Lisa Gray, who's been an extraordinary friend and colleague ever since coming to Houston, making more fruitful. So everyone kind of has a similar background. And I'll start here. I'm an MD, PhD vaccine scientist, and have devoted my life to making vaccines mostly for poverty-related diseases. And I met Ann in New York. We lived in Rockefeller University housing. It used to be the Rockefeller Institute for Medical Research. We lived in Rockefeller University housing for $44 a month. It was the most discretionary money we ever had because I was getting paid $5,000 a year. But but there were no kids, and so we could spend it on whenever we wanted. So we lived at the Rockefeller Institute, where the motto, and with Weill Cornell Medical School next to each other on the Upper East Side, where the motto was and is science for the benefit of humanity, and I believed it, and that's why I became a vaccine scientist, because I thought that was the highest expression of science for humanity, and actually began working on developing a human hookworm vaccine as an MD PhD student. And now 40 years later, that's in phase 2 clinical trials, which is about the right time frame for most vaccines. And although we ultimately turned it around and were able to make a COVID vaccine much faster. And so the point is, what I do today at the Texas Medical Center, at Baylor College of Medicine, Texas Children's Hospital, and here is what I set out to do. The unplanned part was when we had 4 adult kids, including Rachel, as Rachel has autism and intellectual disabilities. And I wrote this book called Vaccines Did Not Cause Rachel's Autism. And that wound up making me public enemy number 1 or 2 with the anti-vaccine groups. But it did give me a front row seat to what this was all about. Our friend Robert F. Kennedy Jr. At the start of the pandemic on his Instagram publicly called me the OG villain, and I'm so old and square I had to look up what that meant, and it means the original gangster villain. So Ambassador, thank you for inviting the original gangster villain here, and then we'll talk about the new book. And with that, we set up this really interesting center for vaccine development, because while the pharma companies were doing a good job making vaccines for the world and lowering death rates from ancient childhood scourges like measles and pertussis and Haemophilus influenza type E meningitis. There were diseases that were falling through the cracks that the pharma companies were never going to make those vaccines because they only occurred in the setting of extreme poverty. So in addition to coming to Baylor, setting up the School of Tropical Medicine, we set up this very interesting vaccine center to make the vaccines the pharma companies wouldn't make. And when I say we, this is headed by myself and my science partner for the last 20 plus years, Dr. Elena Bottazzi. And we began making vaccines for schistosomiasis and hookworm and Chagas disease and leishmaniasis at various stages of clinical development. And then when we first moved to Houston, we thought we should start making coronavirus vaccines, because nobody cared about coronavirus vaccines either. And they were orphaned just like the rest, so we started making vaccines for SARS, severe acute respiratory syndrome. You remember was the original one that came out of China in 2002, then Middle Eastern respiratory syndrome. And then when the COVID-19 sequence hit in January of 2020, we were able to pivot our program and make that, and I'll say more about that in a minute. And we sometimes call our vaccines the anti-poverty vaccines, because these diseases like schistosomiasis and hookworm and et cetera not only occur in the setting of poverty, but they cause poverty because of their deleterious effects on child development and pregnancy outcome, women's reproductive health, worker productivity. So the vaccines themselves are poverty reduction measures. And this is when I wrote my first book, Forgotten People, Forgotten Diseases, which my adult kids used to like to call Dad's Forgotten Book on Forgotten People, Forgotten Diseases. But it's as loving adult kids do. But it's in its a third edition. And one of the things that we do, we do innovative, cool technologies like mRNA and adenovirus and particle vaccines, but we also do something a bit different, which is we try to be compatible with vaccine producers in low and middle income countries. And they band together and they call themselves the Developing Country Vaccine Manufacturers Network. There's about 40 of them in Asia, Africa, and Latin America. And one of the most common technologies they have is they make their own recombinant protein hepatitis B vaccine, which is you probably gave to most of your kids or your grandkids, and it's done through microbial fermentation in yeast. So if you go visit our labs, we've got these bioreactors. It's almost like how you make beer. It's like visiting the St. Arnold's Brewery, but instead of secreting alcohol, they're actually making the vaccine. It's been around for a couple of decades. It's very safe. It's one of the lowest cost technologies out there, and it's very effective. And so the thinking that we had when we set up our vaccine center, look, if we really want to be compatible with vaccine producers in low and middle income countries, we'll make the prototype vaccine, and then transfer the technology to the vaccine producers where they could scale it up and make hundreds of millions of doses. And that has worked relatively well. So we've done this now for hookworm and schistosomiasis vaccines. These are in phase 2 clinical trials. I show you this picture of the two parasites to focus your attention on the map. Imagine if you were the chief executive officer of a biotech or a pharma company. Probably not the map you want in your business plan, right? I mean, because where's the financial return? The financial return's all in North America and Europe and Japan. So the other thing we try to do is to say, well, in addition to doing interesting and innovative science, what's the sustainable business model for how you get vaccines for people who can't afford them on the African continent and Southeast Asia? And this is another reason why I so deeply value our partnership with the Baker Institute, because we can't figure that out on our own. But there are smart people at places like the Baker Institute that could help us do that. So it's also trying to do the business model. And then we applied the same principle to COVID vaccines. What I'm showing you here is a bubble map of the world that was not vaccinated against COVID in 2021. And basically, the bigger the bubble, the more unvaccinated people. So you get the idea. The African continent, Asia, South Asia, India, Indonesia. And what was happening was this. There was so much emphasis on speed and innovation. So the Nobel Prize that was awarded today was for innovation. And it's a very cool vaccine, that mRNA vaccine. But there's a problem with it. And the problem is, any engineers in this crowd? I know there's got to be engineers here in Houston, right? As any engineer will tell you, when you use a brand new technology, there's a learning curve before you can go to from 0 to 15 billion doses that are needed. And that was the problem. It was a science policy failure, that there was so much emphasis on speed and innovation, and what I sometimes said in my frustration, the shiny new toys. And they got some really cool technologies, mRNA and adenovirus and particle vaccines. Nobody had that situational awareness to take a step back and say, wait a minute, if you only focus on that, how are you going to work with the vaccine producers in low and middle income countries to get a vaccine scaled right away? And that's where we came in. We developed that technology. Our scientists got permission to work in the labs in those very dark days of the spring of 2020, and worked furiously to turn our SARS and MERS vaccine program around to make a prototype COVID vaccine. And that's what we transferred to several developing countries, India, Indonesia, Bangladesh. India went the furthest, and they scaled up to produce Corbevax. It's called Corbevax because the vaccine producer is known as Biological E. And 75 million kids got that vaccine as their primary immunization. Another 10, 20 million adults, almost 100 million people got that vaccine. And we provided proof of concept that you don't have to be a big pharma company to do big things. You have to be in Texas to do big things, but you don't have to be a big pharma company to do big things. And that was really important. So this was what it was like in early 2020. We were if anyone's ever done business with Asia or African countries, know what this means. It means getting up at 4 or 5 a.m. so you can get to them by close of business their time. So I was getting up at 4 or 5 a.m. We transferred the prototype vaccines, working with their scientists in the early morning hours. And then at this time, I was finishing my day late at night talking to Don Lemon and Lawrence O'Donnell and Brian Williams. So I didn't sleep for 3 years, but we got something very important done and transferred that technology to India, where they made Corbevax, Indonesia, Indovac, in Bangladesh, and in Botswana and southern Africa. And then we had to raise money because we were cut out of Operation Warp Speed because we're not a pharma company. So the Operation Warp Speed was the big program that was set up by the administration. Another blessing of being in Texas was you can raise money in Texas. We raised about $8 or $9 million, not billions, but enough to pay our scientists, get the prototype vaccine developed. The Dunn Foundation, MD Anderson, the King Ranch, the Clayburgh Foundation came through. Probably some of you in this audience. Tito's Vodka came through with $2 million. Not that I'm endorsing alcohol consumption, but should you have a vodka containing cocktail this evening? Look, you don't want the Russian stuff anyway, right? So you want to go with Tito's. And it worked. And then we transferred the technology. They own it. So we don't try to hang on to it. Our idea, our philosophy is decolonizing the vaccine ecosystem. So they work out with their FDA equivalent, in the case of India's DCGI, with the World Health Organization, how to do the data sharing, how to publish the results, how to do the clinical trials. And they showed very quickly that the level of virus neutralizing, we had shown with Emory University that it worked really well in non-human primates, as good as the mRNA vaccines. They reproduced it in humans, showing the level of virus neutralizing antibody was right up there with the mRNA vaccines, and better than the adenovirus or the particle vaccines. Then they did the step-down studies in kids, and by this time, 2022, 75 million kids have been immunized, and that was very meaningful. Then we worked with Indonesia, and with Indonesia, they had a similar construct that we provided. They came into our labs because we had told them that all of the ingredients in our vaccine comes from a non-animal, non-human source. And they thought that was very interesting. They came into our labs, they inspected everything, and in fact confirmed it. So we have the record of all the reagents used in our lab. So a total, in essence, a vegan vaccine, as I like to call it. But although I gave this at a college lecture, and somebody pointed out, no, it's not vegan because you were tested in animals. Okay, so it's true. So it's a vegetarian vaccine, and because of that, the Indonesians got to work with their clergy and got it certified as halal. It became the first halal COVID vaccine. So interesting things start to happen, when you go to scale. So now we're making the XBB booster that should be ready too. A low cost, $2 to $3 a dose. So it's the lowest cost vaccine out there. Now we're looking at the world, assuming we get on the other side of COVID. Maybe with Lisa tonight we can talk a little bit about what's happening with COVID, but the World Health Organization, the WHO, is looking at the landscape and realizing that with all of the problems with COVID, both because of the social disruptions, also the diversion of resources, the world has fallen behind in terms of our ability to vaccinate the world's kids. So all of those successes that we've been having have sort of gone off the rails. So they're implementing this program on the lower right there called the Big Catch-Up, that they want to start vaccinating all the kids that were missed during COVID-19. It's not starting out so good. So this is some facts from the World Health Organization. I'll call your attention to the ones in the orange, that the global coverage has dropped now from 86% in 2019 to 81% in 2021. You might say, well, that's not a big drop. It's true, but it's the first time it's gone the wrong direction in decades. And then in the bottom there in 2021, the number of completely unvaccinated children has increased by 5 million since 2019. And my worry is this, that we're not going to bounce back. And that's a picture of me in the monk painting over there. And the reason we're not bouncing back is because superimposed on the social disruptions has been this globalizing, aggressive anti-vaccine campaign that started in the United States and is now globalizing. So before I turn it over to Lisa, I just want to briefly give you my Cliff Notes version on what I think is happening with the anti-vaccine movement and take you through 25 years in a couple of minutes on what version 1.0, 2.0, 3.0 looks like with the anti-vaccine movement. So 25 years ago, there was a false claim that vaccines cause autism. That threat is still with us, but I'll talk about that in a minute. And then it morphed to version 2.0 about 7-8 years ago. It became a political enterprise under this banner of health freedom, medical freedom, propaganda, and now it's globalizing. So let me just briefly take you through 1.0, 2.0, 3.0, and then we'll sit and talk. So 1.0 was the false claim that vaccines cause autism. It began with a false paper claiming that it was a measles, mumps, rubella vaccine, which is a live virus vaccine, could replicate in the gut. And somehow that led to pervasive developmental disorder, or what we now call autism. That was published in The Lancet in 1998. It was retracted, but by then you started to see anti-vaccine groups monetizing the internet. They were selling phony autism cures. They were selling nutritional supplements. If you go to Amazon.com and type in books on vaccinations, it's almost all anti-vaccine conspiracy books. So this became an industry. So they weren't taking no for an answer. So then Robert F. Kennedy Jr. came along and said, okay, if it's not an MMR, it must be the thimerosal preservative in vaccine. And you saw where this is going. So each time the scientific community would respond with large cohort studies showing the kids whether they got MMR or thimerosal. It didn't matter. The rates of autism were no higher than kids who didn't get it, and similarly, kids on the autism spectrum were no more likely to have gotten MMR vaccines with thimerosal than kids who didn't. And that should have been the end of it, but then the industry came along. So we got into this kind of Pyrrhic game of whack-a-mole, or moving the goalposts. And so was spacing vaccines too close together, albumin vaccines, or they said it was HPV vaccine for cervical cancer and other cancers that was causing infertility or autoimmunity. So it became this very exhausting exercise. How many people have heard COVID-19 vaccines cause infertility or autoimmunity? Yeah, that's where they got it from. They copy-pasted the fake assertion from HPV and glommed it onto COVID-19 vaccines. And that's where, I weighed in, for better or for worse. That's a picture of me with Rachel in Cafe Brazil. So we live in just a couple of miles here in Montrose. If you're ever walking in Montrose on a weekday morning, you'll see this girl with a big shock of red hair. That's Rachel walking to Goodwill. Goodwill saved our lives. She works for them 2 hours a day sorting clothes. She has autism and intellectual disabilities, and I wrote the book, which does a detailed, it kind of tells the story of Rachel's life now here in Montrose, but also the evidence showing there's no link between vaccines and autism, and what autism is and how it begins in early fetal brain development. So you have to be able to explain an alternative narrative. It's not enough to say, no, it's not, don't blame the vaccines. You've got to say, okay, then doc, what is it? So we did whole exome genomic sequencing on Rachel and my wife Ann and I, and at Baylor Genetics, and found Rachel's autism gene, which is similar to the 100 others that have been published by the Broad Institute of Harvard, MIT, all involved pre-birth, early fetal brain development. A lot of them are involved in neuronal communications. Many of them are neuronal cytoskeleton genes like Rachel's. The point is there's an alternative narrative, and hence I became the OG villain. But it did take some of the wind out of their sails, but then the anti-vaccine groups, and I'll finish up in a minute, the anti-vaccine groups needed to regroup. And they regrouped in a way I would not have predicted. And this is where we got to version 2.0. And as I'll say, like so many things, it started in California, but it amplified in Texas. So in California, by the 2010s on the left, so many kids were not getting their vaccines because parents were worried about autism, that lo and behold, there was a big measles epidemic in California. And measles is kind of the first breakthrough one you see if your vaccination program isn't up to par because it's so highly transmissible. And the California legislature responded by shutting it down. They said, look, from now on, you want to send your kids to school, your kids have to be vaccinated. And I supported that. But then it created a backlash that took off in Texas under this banner of health freedom, medical freedom. They basically said, hey, you can't tell us what we want to do with our kids. And this got endorsed by the Texas Freedom Caucus. And here's where it gets tough to talk about because, all of our training as scientists and physicians says you're not really supposed to talk about Republicans and Democrats and liberals or conservatives. But I haven't found a way to talk about it other than to talk about it. So I'm going to talk about it, or I wrote about it. Empower Texans, a PAC, started funding an anti-vaccine group. So they were getting PAC money from the Republican Tea Party in Texas to create this phony narrative about health freedom, medical freedom. People like Alex Jones weighed in. Then you have Joe Rogan, to invite all prominent anti-vaccine activists in Austin. The consequence was almost 100,000 kids were not getting their full complement of vaccines. And this didn't say anything about the 300,000 homeschooled kids we have in Texas. What percentage of those do you think were not vaccinated? 90? 20? 50? 60? It's a trick question. We don't know. They're homeschooled, so I don't know. but it's a lot of kids, right? So well over 100,000 kids aren't getting their vaccines. And it took this very dark turn. So you start to see prominent anti-vaccine activists descend into Texas. This was the Mecca, right? So here's a picture of one. You'll recognize the familiar pink granite in Austin. And look what he's wearing, a fake yellow Jewish star. comparing vaccines to the Holocaust, right? Offensive as hell, right? And using, no vax written in Hebrew looking like letters. So I took, great offense to this. And then you started to see the sort of smoldering anti-Semitism linked with it as well. And that's what's come off the rails now during COVID-19. So this is a paper I wrote last year. It's called The Great Texas COVID Tragedy. And it's in the Public Library of Science, Global Public Health. And it looks at the 100,000 Texans who lost their lives from COVID-19. And I'm going to show you these familiar peaks and valleys now. So on the bottom there is the timeline, 2020, 2021, 2022, and they're the daily deaths on the y-axis. So that first peak, big peak on the left, is that terrible summer of 2020 when COVID hit Texas, and then the second peak is that alpha wave in 2021. I'll hold off on the green arrow in a second. Then the Delta wave in the last half of 2021, and then the BA1 Omicron wave. And that green arrow is when vaccines became widely and freely available. Anyone who wanted to get a vaccine could. And you can see that in Texas, almost as many Texans died after the green arrow as before the green arrow because they refused to take a COVID vaccine. So for instance, in Canada, which has, Texas has a population of 30 million, Canada about 35 million. Canada has exactly half the number of deaths as Texas, because after their green arrow, the deaths stopped. In Texas, they kept it right on rolling along because so many Texans refused to take a COVID vaccine. Not so bad in Harris County, but especially in the conservative areas of East Texas, Central Texas, the Panhandle. I mean, I gave grand rounds at University of Texas Tyler, the new medical school, and basically everyone you talk to has lost a loved one because they refused a COVID vaccine. And nationally, the number's around 200,000, mostly Texas, other southern states, Arkansas, Louisiana, Mississippi, some in the Mountain West. And here's the tough part to talk about, and I talk about it in the book. This is an analysis done by Charles Gaba, but it's been reproduced now by the New York Times, by Axios, by National Public Radio, and we'll talk about it more in the discussion, breaking it down by party affiliation. So a lead spokesman for the Kaiser Family Foundation said, if you wanted me to know whether or not a person was vaccinated, and I can only know one thing about them, it's their political party affiliation. So what this shows on the right, during that Delta wave, overwhelmingly in red states, and the redder the county is measured by Republican voters, and they used as a surrogate Trump voters for the 2020 election. Even though I don't think this is a Trump phenomenon, I think it started before Trump and it accelerated after he left office. But the redder the county, the lower the immunization rate and higher the death rate, so much so that David Leonhardt, the New York Times, just called it red COVID. Here's some more of Charles Gaba's analysis. On the left that I include in the book, these are counties with large Trump vote shares in 2020, Biden vote shares. I mean, the difference is striking. And then on the right, the percentage of Trump voters on the x-axis, which again, I see as a surrogate for Republican voters, and on the y-axis, percent fully vaccinated, and the R coefficient is striking. So the redder the county, the lower the immunization rate and higher the death rate. So how did this happen? It started at the CPAC conference in 2021 of conservatives in Dallas. First they're going to vaccinate you, then they're going to take away your guns and your Bibles. And as ridiculous as that sounds to us, people accepted that. And then members of the House Freedom Caucus, Marjorie Taylor Greene, called people like me medical brown shirts, and she went on, again, using the Nazi paramilitary analogy, she went on Steve Bannon's War Room podcast, went after me and others, and Jim Jordan. And then Senator Ron Johnson of Wisconsin, Senator Rand Paul, emphasized heavily this anti-vaccine rhetoric. And then the amplifier, Fox News, documented by two groups, Media Matters, a watchdog group, and ETH Zurich, which is the Federal University of Science and Technology in Switzerland, where Einstein studied, documented every night Tucker Carlson, Laura Ingraham, Sean Hannity on their nighttime broadcasts, filled their broadcasts with false anti-vaccine rhetoric, falsely discrediting the effectiveness and safety of vaccine. So people went down that rabbit hole. And so they were victims. This was a predatory, well-organized, well-financed, politically driven anti-vaccine movement. And you know, what I say is, I don't care about your conservative views. It's not even conservative, right? That's not really conservative like we know Jim Baker conservative, right? This is something sort of new and twisted. And how do we uncouple the anti-science rhetoric from this? Everyone's entitled to their political views, but how do we say, don't adopt this one because so many Americans are dying? So when you look at societal causes of death, anti-science activism is right up there with anything else you might consider: gun violence, road traffic accidents, suicide, terrorism. And so I like this comment from Sir Joseph Rotblat, who was involved in the Manhattan Project. He's an immigrant from the UK and Poland, and then he created the Pugwash Conference to call for nuclear disarmament. And he said it pretty well: precepts such as science is neutral or science has nothing to do with politics still prevail. They are remnants of the ivory tower mentality, although the ivory tower was finally demolished by the Hiroshima bomb. So, you know, unfortunately, we do have to deal with politics. And of course, I become a big target. Now, you know, when Steve Bannon calls you a criminal, that's some serious stuff, right? I mean, let's talk about authoritative sources, right? I mean, so, and then the rhetoric is, you know, basically now that Tony Fauci is out of public office, you know, the faux outrage machine needs to keep ramped up. So I've become sort of Fauci light. Basically, the line is, you thought Fauci was bad, wait till you get a load of this guy. And the emails and the attacks and the physical stalkings, that's why I have so much security here tonight, are interesting. When you take during the day, I'm fine. At night, it sort of messes with your head. But look at some of the emails themselves are kind of instructive. So the next one from the bottom, subject, doctor, I use that term loosely, Hotez. You print one more paper or blog suggesting the roundup of free citizens, which I don't, to get an unproven, which it's not, untested shot that is no more a vaccine than an M&M, I will suggest to all my patriot friends that you be hunted. And, you know, so I say, well, you know, all these patriot friends, just me and Ann and Rachel and the cat now. You only need, you know, one patriot, two patriots, you know. So, but then I say, wait a minute, you know, who are the patriots here? This is a nation built on our research universities and institutions, built on Rice University, University of Texas, Austin. We're the patriots, not these chuckleheads that want to attack it. On the upper email, soon the Republicans will be back in charge and investigating your sorry ass. You'll be charged with treason and other crimes against humanity. You'll be sentenced to hang by the noose until dead. I will celebrate the day I see you hanging from the gallows. So there's this kind of QAnon thing that a day of reckoning is going to come. They're going to create Nuremberg 2, and all the vaccine scientists are going down with the ship here. Or, you know, you get compared to Mengele. So it's taken this very dark turn. This one just came out, which, not that I'm comparing myself to Galileo, but I thought it was still pretty cool, you know. But so this is all finished, and then we'll sit and talk. It's not getting better. I'm guessing it's going to get worse till we head to the 2024 election. The anti-vaccine activism is now globalizing. That same rhetoric that you're hearing has gone up into Canada now with the Freedom Convoys. It's in Central Europe. It's now gone into sub-Saharan Africa. So the other big story today is the new malaria vaccine. I talked on the BBC about it. That same US-style rhetoric is now affecting uptake of malaria vaccines on the African continent. So I met with Dr. Tedros, the head of WHO, to discuss it. And that's what the new book is about. So on that light note, let's have a conversation. Thank you so much. What do you want to? It's good to see you in it's good to see anybody in 3 dimensions, but Lisa and I, you know, talked throughout the pandemic. You did a lot of interviews over Zoom. We talked about a lot of dreary things. So
I managed
guess
to meet
this
him once in
continues.
person before everything shut down. So it's a little odd. But
you look great. Great to
thank
see
you.
you.
Peter, what on earth possessed you to move your lab to Texas?
Well, that's what people back in the Northeast were asking when I told people I was leaving to come to Well, first I thought I was bluffing because I was just, going to use this to bargain for something better where I was. And because people don't know the story of Texas, but to be part of this Texas Medical Center is extraordinary. I mean, there's no, what's that? There's, oh, maybe I need my microphone up more. I could just hold it like that.
No.
Well, I like to say, if I hadn't moved to Texas, we would not have made 2 COVID vaccines reaching 100 million people because there isn't that spirit of doing big things. And having the support of people like Mark Wallace, the head of Texas Children's Hospital, and Paul Klotman at Baylor College of Medicine, we have very special leaders of our institutions, and the ambassador, the new head of Rice University, and you can do big things by doing that. But it's hard to explain because especially, when I was all that time going on CNN and MSNBC, how they want to portray Texas, right? And all they want to do is talk about the wackadoodle. And yeah, there is there's no denying it, there is wackadoodle, but I came here to up my game for science and innovation, which is a story that more people need to hear. And we tend not to talk about our institutions in Texas for a national audience enough. We need to do a better job doing that, I think.
When did you become aware of the anti-vaccine movement here in Texas?
It doesn't take long for them to come knocking. Certainly it really ramped up. It was ever since I've come here, because they've known about me, because I've written and talked about vaccines and having a daughter with autism. I think it really ramped up in 2017, even before I wrote the book. So what happened was Robert F. Kennedy Jr. said he was going to be appointed by President Trump, who was about to be inaugurated, to head a special commission on vaccines.
And who is RFK Jr.?
And Robert F. Kennedy Jr., and who's been a very ardent anti-vaccine activist. And right the next day, I get a call. My assistant says, "Hey, Dr. Hotez, Dr. Francis Collins and Anthony Fauci are on the phone. Can you talk to them?" "Oh, okay." And he said, "Peter, we have a job for you." "Okay, what is it?" "You have a daughter with autism. You can explain why vaccines don't cause autism. We want you to talk to Robert F. Kennedy Jr. And we've arranged for someone to be a third party to mediate those conversations." So I did. I started having a series of conversations with him, and it didn't go anywhere because he was just all over the map, and all the thing. You couldn't pin him down to any one thing. So I think we were both pretty frustrated with each other, but then he started ceasing all of these other people on the emails, and they turned out to be some of the most vocal and aggressive anti-vaccine activists. So that was my introduction. Then I wrote the book, and then it was all good stuff from there. Right.
And at the time, was it a right-wing sort of movement?
It did have elements. You already started to see the health freedom movement starting up. But as I used to like to say, it came from the two extremes, the far right and the far left. The far left, the Vashon Island of Seattle, peace, love, granola, we got to be careful what we put into our vaccines and put in there. And so there was that far left element. That's sort of, I don't know that it's gone away entirely, but it's pretty much now much more of a far right component now.
Yeah, I hear about the health influencers who look very natural.
Yeah, the health and wellness industry, and it's a big industry, has a lot of anti-vaccine activism in it, but now it's getting more and more adopted by the far right, which is also kind of interesting.
That's a nice way to put it.
So there's this kind of sort of an unholy alliance is formed between them.
Yeah, give you a second.
Let's see if I can. Is that still good? Okay. Good. Thanks.
So you wrote the book about Rachel, your daughter, because this was the thing you couldn't explain to RFK?
Well, I wrote the book. I wrote the book because I saw there was a vacuum, there was a hole, right? And I thought, look, here I'm a vaccine scientist. I have a daughter with autism. on intellectual disabilities. I know how to write, and if I don't do this, who does? And so I saw a vacuum there, that people really weren't, saying this in very explicit, detailed, scientific terms, but in a way that make people understand. So,
but also the human story.
Yeah,
you were willing to be the face.
And my editor at Johns Hopkins University Press said something very nice to me even before this book, the Rachel book. He said, Peter, you have a nice way of explaining things to lay audiences without feeling like you're talking down to them or condescending, and so we think you should write the book, and I did.
You had some sense of the anger that you were likely to unleash?
I did, and I got it, but it was contained. I think the big game changer was now the people attacking me were the leaders of an extremist element, right? I mean, Steve Bannon and Roger Stone makes no sense, right? But I'll explain why it does make sense in going after you. Or this whole thing with Rogan and Elon Musk and Robert F. Kennedy Jr. I mean, they're basically every follower on Twitter. They have every follower on Twitter except those who follow Taylor Swift. So these were bigger guns,
right.
and they were mad. And this, I don't know, they may not know about this, but a few months back, I got challenged to debate Robert F. Kennedy.
You may have
Jr.
heard. Okay, let's back up just because I don't think everybody was nodding.
Okay.
So you have been on the Joe Rogan show because you were trying during COVID to reach everyone possible.
And Joe was fine.
Yeah.
And I'd done
you'd done
two,
several.
Yeah.
And then RFK Jr. was on, and
let me take a step back. The aggression comes in waves, and it's usually triggered by some high-ranking person on the far right, setting off a dog whistle. So in 2021, Laura Ingraham and Governor DeSantis went after me on Fox News because I predicted the Delta wave was about to slam Florida, which it did 2 weeks later, and they mocked me and said all this kind of stuff. And then that's what sets off the emails and the stalkings and the aggression, the army of patriots coming on me down. Then it happened again in 2022 on the day Mary Elaine and I were nominated for the Nobel Peace Prize. Whether it was in spite of it or because of it, Tucker Carlson just went on this god-awful rant. And again, that sets off for weeks this whole wave of stuff. So this time, there was, the Steve Bannon was starting to call me a criminal. I said, I wonder if this is another wave. And then, like 2 days later, Joe Rogan interviewed Robert F. Kennedy Jr., and he said all the usual stuff that I'm secretly taking money from a pharma shill, or I'm taking money from Pfizer and Moderna. Meanwhile, we had made 2 vaccines that, provide a proof of concept that you can bypass the pharma companies, but the reality doesn't matter to them. And then Anna Merlin of Vice News, put out a tweet about what Robert F. Kennedy Jr. said about me and others, and I retweeted it with some very modest commentary on my own. And Joe saw that as a smoking gun. I think he was looking for something, and then he publicly challenged me to a debate. And then Elon Musk, chimed in and said, if he doesn't debate you, let's find out what he's hiding. So what was my response? Well, there was at multiple levels I wasn't going to do it. First of all, and then they offered me lots of money.
They did?
Joe Rogan said, "He'll give me $100,000." And then all the billionaires chimed in. These billionaires with too much time on their hands. Bill Ackman, another 100,000. The pot got pretty high.
This could buy a lot of vaccine.
Yeah, right,
Yeah.
right.
Uh-huh.
And I declined for a number of reasons. One was I said, I think it sends the wrong message to young scientists how we do science. I mean, we do have a way of doing science, right? Which is we make our discoveries, we write our papers, we send them to scientific journals. They get peer reviewed, they sometimes get rejected, or extensively there's a call for revisions. You can go back and forth for 6 months to get a scientific paper accepted. an NIH grant, the same thing, or it can get turned down. Or then you present your findings to a scientific audience of your peers, and they give you feedback as well. And sometimes it's not always kind feedback, but the system works. And I said, that's how science is done. I haven't really thought of too many instances where science is advanced in a debate format, right? I mean, I was thinking, maybe Niels Bohr and Einstein in the 1920s, would have these public discussions about quantum theory and relativity, but those were two equals, right? Having, not really trying to do I gotcha, it was just trying to figure stuff out. And so I said, you debate, I understand you debate politics, you can even debate 18th century Enlightenment philosophy and like Rousseau and Bishop Berkeley, but that's not how we do science. So I didn't want to send that message to young people, that science goes to the one who's more clever at a debate. I think that would be damaging. And then there was the issue of Robert F. Kennedy Jr. himself, and because I had been speaking with him and I knew how unproductive conversations with him can be, and he's just all over the map and just keeps on moving the goalposts, right? And so I didn't want to do that, and also I didn't want to help him. I mean, this was someone who's running for president, and it was clear that having a prominent U.S. scientist appear with him in a public format was a way to kind of schmooze him up, to make him something that he wasn't, and I didn't want to be that guy. I mean, Molly Jong-Fast, who's a political commentator afterwards, told me that she thinks the reason Bannon and all these guys are propping him up is because they want a strong third-party candidate to take votes away from Biden, because that's the path for Trump to win the election. Maybe yes, maybe no. That I can't say. But no, I didn't want to help Robert F. Kennedy Jr. in that way. So for all those reasons.
But it's not because you're a shrinking violet. So
right. I mean, I said to Joe Rogan, I'll come on your show like I always have, but not to quote do a debate with Robert F. Kennedy Jr. And I was going on Fox News a lot in the beginning, and even Tucker Carlson and Hannity, and it's when I wouldn't go along with the hydroxychloroquine nonsense that the invitations for the evening news broadcast stopped. Although the daytime anchors hung in there with me for a while. Bill Hemmer was a good guy, and Harris Faulkner and Sandra Smith, they hung in there with me until Laura Ingraham and Tucker Carlson appointed me Fauci light, and then they couldn't have me on anymore, so then it stopped.
Yeah. So let's back up.
But to this day, if OAN or Fox News or Newsmax ask me on, I'll go on.
Yeah. I want to back up to like 2019, early 2020. Did it occur to you that what might be a pandemic would ever become political?
Well, I first saw it early on when, Peter Navarro came out of the White House and said that this was all started because the Chinese Communist Party was sending infected Chinese aboard airplanes. And I said, oh my God, what is this? And I said, not only is it ridiculous, it's also very offensive. It's going to also start a wave of anti-Chinese, anti-Asian racism, which it did. And then it came, and then it was, from the West Wing of the White House, the COVID's nothing worse than the flu. Kelly McEnany, was saying that the hospitalizations were catch-up in elective surgery, and I'll never forget this, and because Ann was with me. So back then, in 2020, I was in the corner of the bedroom with a bunch of books behind me, and I think you photographed a picture of it and revealed that the laptop was on a box of seltzer, and that was that's how I was talking. But on the other side of that was the cat, bored to tears, and sometimes Ann, and I'll never forget, when Trump came out and said all this stuff. I said, Ann, what is this? I said, I know what this is. This is an anti-vaccine disinformation campaign. This is an anti-science disinformation campaign. I know because I'm the expert. I've been up against these guys for years. I know exactly what this is. And Ann is the one who's usually the one who is sort of talks me off the ledge, right? She's, you better sleep on this. Why don't you think about it? Because Otherwise, you're going to regret what you say. Uncharacteristically, and Anne could vouch for this, she was just the opposite. She said no. She turned into Lady Macbeth. She said no. If you really feel that, you need to say that. And that gave me all the courage I needed. So, and I did it. And it's been an interesting roller coaster ride ever since.
So to speak.
Right, Anne?
Yeah. So, trying to think, you were testifying before Congress, you were saying, here's what to do, here's, how we develop vaccines, here's, closing the borders. When did it begin to feel very, very political?
I would say
it was always political, but it wasn't partisan. It hadn't yet become a partisan.
It came in waves. So the first part was, the downplaying of the pandemic by the White House in 2020. Then it was okay for a while, but I benchmark a year later, the CPAC conference of 2021, when they brought in all these anti-vaccine activists. They said, they're going to take away your Bibles and then vaccinate you. That's when it really took off. And then you saw the members of the House Freedom Caucus really pile on, and Senator Johnson and Rand Paul. And then this all began right at the start of the Delta wave. So we're talking about spring, summer of 2021. And then Fox News just was out of control and just saying the most vile things about vaccines and immunizations. And that's when I saw this was going to kill people. And I responded. First, I wrote to Joe Rogan because he had me on. I said, Joe, have me back. This is going to kill people. And instead, he started inviting all of the other anti-vaccine activists. And that was very frustrating. John Berman on CNN called me a Cassandra, which I had to look up my Greek tragedy history. He said, Cassandra is someone who's fated to tell the future, but equally fated not to be believed, and that really was the case, and it was exasperating to watch this. And by the way, in the middle of all this, I had a day job, right? I mean, I had to get the vaccines out in their lab meetings. That was hard work, and then to raise the money for it, it was, I wasn't sleeping. It was a tough time.
Yeah.
Meaningful time, but a tough time also.
So you've been thinking a lot with the new book about the sort of larger context of the anti-vaccine movement and how it's slid into something larger. What is the background to this? What is the larger picture?
Well, first of all, the two pieces that are happening are the globalization that I mentioned. So now this is, the U.S. likes to export our culture, right? We export our movies, we export our music, now we're exporting this stuff. But the other piece now, it's not only targeting the science, it's targeting the scientists. And here's what you're seeing right now. There's this revisionist history going on. And maybe it's because of the book or other things I've said, but if you've just been accused of assisting in the murder of 200,000 Americans because you convinced them not to take a vaccine. Maybe murder is too strong a word, but you get the idea. You'd think there'd be some pause for self-reflection. Instead, what I'm seeing is a doubling down and coming from the same cast of characters saying, no, it wasn't COVID that killed Americans, it was the vaccines. It was absolute nonsense, right? Those vaccines are 90% protective against death and severe illness during the Delta wave. And the estimates are the mRNA vaccines here saved 3 million American lives. So they want to blame the vaccines, but the other is to blame the scientists. They want to say the scientists created the COVID virus. Equal nonsense. So there's this kind of revisionist history going on. It's playing out now in this very interesting way. I'll see, interesting with an asterisk, in the House hearings. So the GOP controls the House. And they're holding these COVID subcommittee hearings. And they're basically parading prominent US scientists in front of C-SPAN cameras to humiliate them. And they're not even pretending this is anything other than political theater. On their official Twitter site, the House COVID subcommittee hearings, they said in June, it's still up there, we're going to sell popcorn. I mean, they're not even pretending, but to destroy American science, right, which is, been the bedrock of our national security and democracy. My dad fought in World War II. He was 19 years old. It was 1944. The Navy said, sign here. It was called the V-12 program, and we'll send you to medical schools because we need medical officers. So he signed there. And instead they sent him to Okinawa, Saipan in the Philippines on a landing ship transport, And he saw a lot of action. Ultimately, was buried in a Jewish cemetery in Avon, Connecticut, full military honors in 2015. That was very moving. But he was very proud of the fact that I was a scientist, because Dad's a real patriot, not these guys, right? So this is how we've got to right the ship. That this idea that science is being portrayed as, or scientists are being portrayed as public enemies, are enemies of the state. That we have to have zero tolerance for. And I think that's point one. And then you say, well, is there historical precedent for that? And I explored that a little bit in the book. And to do that, I had to talk with prominent political scientists or read political science. So I like to convince myself I'm not too old to learn new things. So I've been taking sort of a crash course in political science. Again, being part of the Baker Institute is great for that. So I talked to Ruth Ben-Gat at NYU, who's a history and political science professor, who wrote the book Strongman, or the writings of Hannah Arendt, who wrote The Origins of Totalitarianism, or Anne Applebaum. And all three point out that for authoritarian regimes to succeed, you have to decapitate the intelligentsia, especially the scientists. So what did Stalin do? Stalin sent the Mendelian geneticist Vavilov to the Gulag to favor Lysenko's Lamarckian theories. And even though they were completely wrong and it destroyed the Russian wheat crop and caused a horrific famine, killing 2 to 3 million Soviet peasants, that was less important than having political control over the scientists. And of course, we're not sending scientists to Gulag yet, but well, we'll see. But that's the idea. That's what this is. This is an authoritarian attack on science and scientists, as far as I can tell.
Which brings me to the depressing question: what's going on with COVID right now?
Well, COVID. So, remember that? Yeah.
Yeah, vaccines in general.
So
yeah.
the COVID numbers are going up. The good news was they reached a low point this summer, in end of June, beginning of July. They're about the lowest they'd been in years. They've been coming up pretty steadily ever since. It's hard to follow it because we're not doing the monitoring anymore, and the states aren't reporting it to the CDC like they were. So we kind of depend on surrogates like the Rice University wastewater COVID testing has been very helpful. That's been going up pretty steadily. Hospitalizations have been going up. But I say with an asterisk because it's starting at its lowest level, but it has been going up. That's the reason why it's really important that everybody get this new, I'm not supposed to call it a booster anymore now, it's called the annual immunization, but it targets the currently circulating XBB variant. So I got mine last week, and I think that will help quite a bit, because even if you've not been boosted in a long time, and most Americans didn't get the bivalent booster last year, even though the numbers are low, they are going up and you're still at risk of hospitalization. The other reason for getting that booster or annual immunization, everyone focuses on the deaths and hospitalizations, but there's another piece to this as well. While long COVID can occur in anyone, even with asymptomatic COVID, the likelihood you'll get long COVID goes up with a severe illness. So it turns out vaccinations give you about a 30 to 40% reduction in the likelihood of getting long COVID if you keep up with your boosters as well. And people forget about the long COVID piece. Yeah.
Do we have any numbers on vaccine uptake this time around, this annual?
It was pretty bad for the bivalent booster last September around this time. Only about 20%, under 20% of eligible Americans took it. And then you were eligible to take a second bivalent booster in the spring. I took it, and about 6 other people in the country took it. But not most of us did. And you took it? Yeah, not many.
Yeah.
And then, and so I don't think the numbers are going to be very high. I mean, there's some polls that came out that don't look so good. And I think people were not doing a good job explaining the need for it, why you're still vulnerable, why you don't want to get long COVID if you don't have to, and why it can still keep you out of the hospital. But we're not doing a great job conveying that message.
Yeah. You were talking earlier about not wanting to give the wrong message to young scientists about the way that science is done. You know, this measured, stately process of arriving at truth, or as close to truth as we can get.
Right.
How does that push and pull work when you've got to get a message out to people who are not scientists?
Yeah.
When you've got a reporter on the phone saying, okay, Peter, what is this COVID thing? And
Yeah, or when you're,
Yeah.
sitting there with Wolf Blitzer for 4 minutes,
Yeah.
how do you do that?
Right,
And well, I did something a bit
Yeah.
different, in part because I'd been working on COVID vaccine or coronavirus vaccines for a decade before, so I was able to approach it with a depth and breadth of knowledge that a general, regular physician would not. And one of the things that I found was the American people. Well, there were 2 populations. One was watching Fox News, and they weren't tuning into anything I was saying. The other were basically, we're all in. Hey, doc, just tell me what I got to do to keep myself and my family safe. And they were able to tolerate a very high level of complexity. So that's one of the things that I always do, go into my underlying assumptions, and people appreciated that. I think in terms of, to say where the poor communication was, I think the Health and Human Services agencies, CDC and others, clung to this old school way of communicating, that some communications person told them you have to talk to the American people like they're in the 4th grade or 6th grade. And I found that was not my style, and I found it wasn't very effective. And I think that came back to bite everyone when they didn't explain their underlying assumptions. So when they gave out information that turned out to be wrong, they couldn't backtrack and say, yeah, I did say that, but I said this is the basis for it. So let me give you an example. When the mRNA vaccines came out, you remember 2 doses, either 3 or 4 weeks apart, and that was the message from Health and Human Services agencies. And to make it more complicated, you had Moderna and Pfizer sending out press releases. And when the companies send out press releases, they're not writing for you or for me, they're writing for their shareholder. And they were spectacularizing their results, making it sound like the mRNA vaccines came out of nowhere, which was great for jacking up the stock prices, but it also created a lot of insecurity in the American people. Whereas I would point out, wait a minute, I've been working on coronavirus for 10 years, and the mRNA has been around in the 2 Nobel laureates this morning have been working on mRNA for 10 years. There was the timeline for these vaccines was the same as any of the others. And then I said, well, I know we're talking about 2 doses now, but when you look at all pediatric vaccines, the way it works is you give a series of primary immunizations, you wait 6 months to a year, and then you boost. And don't be surprised if we're going to need a 3rd immunization. So it may not be 1 and done and 2 and done. It could be 3 and done. And so when the Delta wave hit and the 3rd one was needed, I was looking really good. But the one part I didn't get right, and I don't think anybody did, was the mRNA boosts were not holding up. That you needed another boost every 6 to 8 months. And that was a big disappointment in the technology. I had not seen that before. But that was the reality. But at least it was better than saying 2 doses and we're done, which I think was a big mistake.
Yeah. So
let me give you another example. The vaccines were approved on the basis of halting symptomatic illness. But then the Israelis came up with data after those 2 doses during the alpha wave that we were stopping transmission as well. It's because the virus neutralizing antibodies getting into the nose and mouth, and you weren't shedding virus anymore. And that's why the masks came off.
Yeah.
But the CDC didn't explain that, because when the virus mutated to the Delta variant, you were losing, the level of virus neutralizing antibodies went down, and you were no longer getting high levels of virus neutralizing antibodies in the nose and mouth. And then the masks had to come back on. But if you didn't explain the basis of it, that just created a lot of confusion. Now everybody knows.
So, going back
But,
to, yeah,
but you know, a new pandemic,
I'm used to this.
a new pandemic, you know, you are going to make mistakes in communication. The problem was you had this other side weaponizing every slight nuance or things that was a bit off and blowing it up and eroding confidence. That did a lot of damage.
And you spoke a bit earlier about the sort of global damage, about how we're seeing worldwide reluctance now to take vaccines. How is that playing into global politics?
Yeah, well, first of all, I'm worried here at home. I don't know what the spillover is going to be for childhood immunizations. Are parents going to be as eager to vaccinate their kids now? I'm not confident, especially in a state like Texas where the anti-vaccine movement is so powerful. I do worry we're going to see now, we're not going to get back to baseline. And I certainly think that's happening globally as well. And so I think there's been, you know, whatever metaphor you want to use, a tear in the matrix or disruption in the ecosystem, I worry the backpedaling is going to be I can't figure out the word to use, but we're losing ground. And these 20 years of successes since the launch of the Gavi Alliance, the Global Alliance for Vaccines and Immunization, I worry has slipped a lot, and it may take us a long time to recover, if we recover.
Yeah. And the global political backdrop, is that similar to the United States? Do we see more anti-vaccine movement?
Well, I worry about, you know, the effect on science. So I was down in Brazil a couple of months ago because in the Bolsonaro regime, you know, Bolsonaro was similar. He refused to get vaccinated. He was a populist or a far-right individual, and so the science took a big hit. So they're suffering now from that as well. And Latin America has never had much of an anti-vaccine movement up until then. So I worry this is spilling over into Latin America. Viktor Orban in Hungary, I worry that's happening as well there. So wherever you see kind of authoritarian strongmen regimes, it's targeting the science and scientists. This is the new signature of it, or not so new, but old signature resurfacing. So I think that's going to be problematic.
So I wanted to talk a little bit about you personally, as one of the scientists who's been targeted. How have you seen that?
It happens, well, if you ever look at my Twitter account, Lady Gaga calls Twitter the toilet of the internet, and I think she's onto something. You know, during the most of the pandemic, it was great because it was never perfect, right? There was always the online harassment, but it was still a venue where scientists could exchange ideas. And because the incoming was so much, there were just so much data. I mean, one of the things that I was doing, I did a weekly Zoom with colleagues, Mike Osterholm from University of Minnesota, Eric Topol, Peggy Hamburg, Bruce Gellin, Ruth Berkelman, Penny Heaton, because no one person could handle all the incoming, so we were exchanging notes and ideas, and there was a lot of that coming in on Twitter, so it was really beneficial to have that. And then when Elon took it over, he invited back all the anti-vaccine activists that were kicked out, and then the bot and troll machine really ramped up, and a lot of that is coming from Russia. So what Putin does is he looks at sort of the wedge issues that divide the country, and whether it's the 2020 election or other things, but he's taken on vaccines. And what Putin does is interesting. He floods it with both anti-vaccine bots and pro-vaccine bots, because his agenda is different. He just wants to blow up the country. So this is his way of doing it. So it's become really harsh and hostile, and that's where, being hanged at Nuremberg and firing squads and a lot of violent imagery, a lot of Nazi imagery. They love their Nazis. So that's Twitter, and then the emails you saw. And then there's the physical stalkings, which get tough. One came to my home not long. I mean, I am a fairly public person, right? Most people, if they really want to find out where they live, it's not very hard. One, they could just ask Rachel, and she'll tell you. She sometimes invites people over in the home, and that's always sort of interesting. And then, so now when I go speak at a venue, I have to have security ahead of time because you don't know if somebody's going to rush the stage or if somebody. Most of the time, it's more harassing than anything else. They lay in wait for you to come in to the venue, then they'll shove a cell phone camera in your face and say something provocative to you in the hopes that you respond. And if you make the mistake of responding, which I sometimes do, then they'll edit it and put it up on YouTube to make you look stupid, and that's so it's mostly that. But then there are the more aggressive threats, which are very worrisome. And then, they love sending swastikas to my home. Where do they get all the swastikas? And so then I have to get the FBI involved, and because it's across state lines, and so in the new book I dedicated it to the Texas Medical Center Police and the Houston Police Department. Who've been great, and they've had to park out in front of my house for periods of time, or the Harris County Sheriff's Office. So they've been wonderful. So I dedicate the book to them appropriately.
Because there are still.
Yeah.
Because there are still some branches of government that do support science and citizens' rights to speak.
Most Americans do. And as I say, the 200,000 who lost their lives are those who espouse anti-vaccine views. The vast majority are victims of this very predatory movement. The Kaiser Family Foundation did a demographic analysis of those who are refusing vaccines, and other than coming up with the fact that they're Republican or living in a red state, the big driver overwhelmingly was low educational attainment. So, they're victims of their being by these predators who are targeting them. And one of the things I said, Anne doesn't like when I use this, and she doesn't like my metaphors or analogies. But I said this at a medical grand rounds at Stanford, which is in Palo Alto, California, and I did it right after giving grand rounds at University of Texas Tyler. And I said, look, my car had broken down with a flat tire, and you gave me the choice of having that car broken down in Palo Alto, which is a very wealthy part of California. Not all of California is wealthy, but Palo Alto especially, or Tyler, Texas. I'd take Tyler, Texas in a heartbeat, right? Because people would be fighting over who's going to help you change your tire, right? So these are extraordinary people who are being targeted, and it's just heartbreaking to see that.
Could you talk a little about who is targeting them?
Yeah, and I name names in the book, which is why after this I'll go into the witness protection program. but it's members of the House Freedom Caucus, including some that are holding these hearings from the COVID subcommittee, and two prominent U.S. senators, Ron Johnson, who held these vaccine injury roundtables, and Rand Paul, that openly seeks to discredit scientists. Governor DeSantis has been awful. Two of them are running for president, right? RFK Jr. and DeSantis. Incredible, right? And then the role of Fox News, more than other the other conservative outlets have not been great, but I think I see Fox News as the most egregious because you had 3 million viewers every night, and they went out of their way to do this. So,
you're clearly not backing down.
No, it doesn't look like it.
You haven't thought about it.
Well, I sometimes think about it.
Are you getting a little more? Yeah, are you getting a little more rest now that the pandemic has slowed down? I used to worry about you.
Well,
I still worry about you.
We still have a lot to do. We have the XBB version of our vaccine. That's looking great. We're trying to make a universal coronavirus vaccine. We still have our other parasitic disease vaccines that we want to see to the finish line. And then, raising money for this is always challenging, so I'm spending a lot of time doing that.
As well as fighting authoritarianism.
Fighting authoritarianism. Yeah, on the one hand, it feels good to be in the mix and know you're doing big things. And as I say, during the day, I'm fine. It's at night it starts to mess with your head sometimes, all the aggression and things. But most of the time, I feel actually fulfilled and good.
Yeah.
And Anne's still hanging in there with me too. Which is,
And you would urge other scientists to join you?
and they are. I mean, privately, I get a lot of support from the scientific societies, national academies. Publicly, it's not as big an endorsement as I'd like. Part of because they see how I get beat up and say, who wants that? But I think also, there is this commitment to political neutrality. Well, for one reason, because they need donors from both sides of the aisle, as I do, but also, a case of the national academies, they depend on the Congress for their projects, right? And so that makes it very tough for them. So they're in a very difficult position. Fortunately, Baylor College of Medicine and Texas Children's Hospital and the Baker Institute, right? You're hanging in there with me too. So that's been great. That's been very gratifying to see that kind of support, because not every place has been supporting their scientists.
Yeah. Any closing thoughts? Anything you want us to leave here chewing on?
I think the closing thought is the lack of certainty where this is going. I suspect it's not going to get better up until the 2024 election. I think things are getting crazier than ever, and so I'm anticipating that. Then what happens after the election, who knows? I don't know. But I am worried for the country. We are living in a very dark, not only because of science, but for other things as well. We are living in a very dark time, and I tend to be optimistic because I work on something called neglected diseases. But in the past, I've always said, well, this will autocorrect, especially around the vaccines. And by autocorrect, I mean, parents aren't vaccinating their kids in the community. There's going to be a measles outbreak or a pertussis outbreak. Parents will see that some kids went to the hospital in the community. That's a self-correcting mechanism, right? But now, after 200,000 deaths and this doubling down, trying to blame the scientist, I don't know. I think that's a very uncertain. I think we're in a very uncertain place right now.
All right. Thank you
Thank
so
you.
much, Peter.
Thank you so much. That's great. Thank you. Thank you. Thank you very much. Good job.